Good morning. My name is Brittani Cookinham. I am a doctor in physical therapy, certified athletic trainer, PhD candidate, and instructor at University of St. Augustine. So we explored concussion history, career status, cumulative years of contact American football, in sport concussion assessment tools, and elite athletes. I would like to quickly acknowledge my co-authors. So Dr. Chad Swank is the head of research at Baylor Scott and White Hospital in Dallas, Texas. Dr. Weber, Dr. Medley, Dr. Kelly Brzolera are all physical therapy professors at Texas Women's University in Dallas, Texas. So 1.6 to 3.8 million sports-related concussions are reported per year. Football accounts for the highest incidence of concussions amongst sports-related concussions and has potential long-term neurophysiological and neurodegenerative concerns. The influence of concussion history, career status, and cumulative years of exposure is largely unexplored, thus bringing us to the purpose of this research study to determine if concussion history, career status, and cumulative years of exposure influence these components of the SCAT tool. So for concussion history, we had athletes self-report their concussion history. They were placed into two groups. The low concussion history group was 0 to 1 concussions. Multiple concussion group was 2+ concussions. Our projections were those with multiple concussions would perform worse in all categories: greater symptom severity, greater deficits in balance, and greater deficits with neurocognitive performance. For career status, we divided the athletes into three groups. Draft prospects were pre-professional athletes. They were invited to the NFL Combine or had invitations for NFL Pro Days. Active professionals came from professional and semi-professional organizations, including NFL, CFL, and arena football leagues. And lastly, retired professional players also came from NFL, CFL, and arena leagues. We hypothesized that individuals who were retired would perform worse in all categories. So I had read some literature exploring American football players had sustained 1,000 subconcussive hits per season. So then I started thinking, well, what if it's not the amount of concussions? What if it's not concussion history? Or what if it's not the level of play, looking at the career status? Maybe being subjected to 19,000 hits in 19 years would have some effect on these findings. So for cumulative years of football exposure, our subjects self-reported when they first began playing contact football, and then also the cumulative amount of time that they had played contact football. Our biostatisticians broke this down into three groups: less than 11 years of exposure, 11 to 19 years of exposure, and then greater than 19 years of exposure. So our methods, we had elite football players between the ages of 18 and 45. If they had sustained a concussion within the last 30 days, they were excluded. They were brought through the entire SCAT-3 concussion tool. They were also asked their medical background, football positions that they played, concussion history, and cumulative years of exposure. We had 102 participants in the study. Average age was about 27 years old. Total years cumulative play was about 16 years, and the mean number of concussions was about 2 concussions. So I won't bore you too much with statistics, but for concussion history, the group placement, low concussion was 0 to 1, multiple concussions, 2+ concussions. We used a Mann-Whitney U test to look at total symptoms, symptom severity, SAC total scores, and the M-Best balance scores. For career status, a negative binomial was used to look at the career status groups, the draft prospects, active professionals, and retired players. And then cumulative years of football exposure, we looked at negative binomials, again looking at those three groups. So for our results, 60% of our participants reported having symptoms, the greatest being fatigue, trouble falling asleep, difficulty remembering, and difficulty concentrating. For our multiple concussion group, those who had reported greater than 2+ concussions within their history, they had 3 times greater total symptoms and 3.5 times greater total symptom severity compared to those who had 0 to 1 concussions in their history. I apologize for not defining the SAC here. SAC is a standardized assessment of concussion. That's looking at orientation, immediate memory, digits backwards, months in reverse order, and the delayed SAC recall. So that is a scale of 0 to 30, 30 being a perfect score. So those who had multiple concussions had 1.42 points less than the low concussion group. When looking at career status, professionals reported 1.8 times greater total symptoms, 2.35 times greater symptom severity compared to draft prospects. When looking at retired professionals, they had 7 times greater total symptoms, almost 9 times higher symptom severity, about 2 points lower on the SAC, and 3.6 more balance errors. When looking at cumulative years of contact football exposure, those who had 11 to 19 years of exposure had almost 4 times higher symptom severity. When looking at 19 plus years of exposure, they had almost 7 times higher symptom severity. So with our conclusions, we found that retired players, those with multiple concussions, and those who had played greater than 19 years of contact football were more likely to have more symptoms, greater symptom severity, and have lower SAC scores. Since our retired players are the only ones that demonstrated reduced balance, we suspect age may be a confounding factor. However, our mean age for our participants was 27. The mean age for our retired players was 32. Future research is recommended to further explore these relationships. With any study, there comes limitations. This research study was a sample of convenience. The athletes did report their concussion history. Unfortunately, a lot of the study was subjective in nature. They were reporting their own symptoms and symptom severity. The MBES sensitivity is unknown and subjected to the human eye and error as well. There was also a lack of controls in this study. So evolving from this study, our next study, we will be including a control group, we'll be including the vestibular ocular motor component and a dual task component. So we do hope to evolve from this current study. I would also like to acknowledge our biostatistician. And any questions?
So again, the driving factor in your study really has to do with how many, or part of it anyways, how many concussions an individual reported. Yet we really don't know in any way, we don't know how to define concussion, we don't know who had a concussion, and we don't know in any one case whether even any of them had even one concussion. We just don't know. So it's a limitation of your study, you said that. But isn't that a big limitation of the study? Like, how can you draw any conclusions if you don't know really who had a concussion, what the concussion looked like, and how many they had?
That's fair.
I have a different question, actually. You reported they complained about some cognitive deficits. How about mood? Because we find a lot of mood deficits.
So part of the SCAT, it asks about anxiety, depression, mood changes, so it's part of the symptom checklist, and then they score, so it's purely subjective. So dichotomous yes or no, and then the Likert scale 0 to 6. So it's just they're self-reported for those 4.
And they weren't significant in your...
We didn't break it down by symptoms, because there's 22 symptoms.
Okay.
So we just did the cumulative symptom score and the cumulative severity score. So I can get that answer for you, though.
Hi, yeah, I just had a quick question. So I noticed in your groups that you had separated by years of exposure, there was a really wide variability, especially in the, I think 11 to 18 and the 19 plus. So I was wondering if you had explored any demographic differences to try and explain where that variance may be coming from.
Yeah, great question. So that was our biostatistician who found the cutoff points. But initially, I had read some research starting that was exploring the age at which individuals began playing contact football, and they were using the age of 12. So I actually had our biostatistician use this 12 as the cutoff, and he didn't find any significant findings. So actually 11 years of age beginning playing contact football is where our cutoff score was found. So that's where he used 11. I can ask our biostatistician for further details if you'd like.